Okay, let's get your fetal circulation notes out. Let's talk about fetal circulation. Fetal circulation is a modified circulatory system. The fetus needs oxygen and nutrients to grow. It also needs to get rid of carbon dioxide and metabolic waste products. And remember, its lungs don't work, so not yet. So there has to be some way of getting oxygen for sure. So let's go through your notes. The placenta, if you look to the far left, the placenta removes carbon dioxide and waste from the fetal blood circulation. So there's the placenta there. It's a discoid structure shaped like a disc, highly vascularized, and it's in close association with the capillaries of the uterine lining. So continuing on your notes, it also allows oxygen and nutrients to pass from the mother's blood supply to the fetus by means of diffusion across capillaries. The placenta is highly vascularized and is in close association with the uterine walls, or close contact with them. Normally, there is not maternal and fetal blood mixing. Normally, the capillaries do not join with each other to where the fetal blood and the maternal blood mix. It's usually supposed to be just by osmosis and diffusion. Blood from the fetus is brought to the placenta by the umbilical arteries. They're coming from the fetus going to the placenta, which are branches off of the internal iliac arteries. And you can see right there, there are branches off the internal iliac arteries. Oxygenation occurs at the placenta. Blood carrying nutrients and oxygen return to the fetus by way of the umbilical vein. Remember, veins conduct blood toward the heart, and arteries conduct blood away from the heart. So this has nothing to do with whether it's oxygenated or deoxygenated. This is the direction of blood flow. It's returning to the heart, but just so happens to be oxygenated blood. The umbilical vein enters the liver. So let's enter the liver. The umbilical vein enters the liver as the ductus venosus. Ductus venosus, D-U-C-T-U-S, second word venosus, V-E-N-O-S-U-S. The name changes. After birth, this vessel atrophies. That means it wastes away, or it becomes collagenous and becomes a fibrous cord called the round ligament. Oxygenated and deoxygenated blood mixes in the inferior vena cava. So when that blood goes past the liver, it enters into the inferior vena cava where it's mixing with deoxygenated blood coming from the fetus itself. You can see the arrows. So the blood's going to mix. This blood enters the right atrium, and you can see it's entering the right atrium. I have it marked on here. Since the lungs are not yet functioning to oxygenate the baby's blood, the heart has a couple of modifications. In the septum, the wall between the atria, between the right and left atria, there's a hole. There it is right there. You see depression because it's closed right now. But there's a hole with a one-way flap called the foramen ovale. F-O-R-A-M-E-N, second word, O-V-A-L-E. It's an oval hole. Blood is allowed to pass from the right atrium to the left atrium, so it bypasses going to the lungs. About a third of the blood enters the right atrium, passes through the opening, and is sent into the systemic circulation. After birth, this opening closes and becomes a shallow depression called the foramen ovale or fossa ovalis, either one. Fossa ovalis is just a little shallow spot. Even on the models, you'll see the shallow spot there where the foramen ovale used to be. So it closes up after birth. And the reason it closes up is that the fetal lungs are now oxygenating the blood, and it doesn't need that shunt. The other 2/3 of the blood is sent into the pulmonary trunk. So see, it goes from the right atrium into the right ventricle, and then it's going to go up into the pulmonary trunk. There's a pulmonary trunk, and you know the pulmonary trunk is an artery, right? But most of it passes through Another shunt called the ductus arteriosus, D-U-C-T-U-S, second word, arteriosus, A-R-T-E-R-I-O-S-U-S. So it's a shunt. It keeps the blood from going to the lungs. Which vessel which connects the pulmonary trunk to the aorta. This shunts most of the blood away from the pulmonary circulation, since the lungs are not yet functional in the oxygenation of the baby's blood. So we have two modifications there that have shunted the blood away from going to the lungs. After birth, this vessel atrophies. It's going to shrivel up and become non-functional again, fibrous structure, fibrous cord, the ligamentum arteriosum, L-I-G-A-M-E-T-U-M. Second word is arteriosum, A-R-T-E-R-I-O-S-U-M. So you can see the fetal circulation is a little bit different. It has those modifications because the fetal lungs don't work, so it can't oxygenate blood, but it has a way of doing that across the placenta. And then the fetal heart avoids sending most of the blood to the lungs because the lungs are not functioning yet, and sends it right on out into the body. Also, waste materials are lost through the placenta, across the placenta to the uterine wall into the mother's bloodstream, and she eliminates the waste herself.